Young people are dying in America. The United States has the lowest life expectancy for a developed country, and this is nothing new. For the better part of a decade, American lives have grown progressively shorter relative to peer industrialized countries. But beneath the surface, several striking details demand all of our attention. Before I get into this epidemic, this is the legal code, and on this channel we discuss a wide range of legal topics, whether that's public policy, laws that I think that you should know about to protect yourself, and occasionally we talk about shenanigans that relate to pop culture. But this is not even a gossip channel or a channel that's dedicated to pop culture, only if there's a legal component that I think that you should know about to improve your life and improve your quality of life and help you. That's the only time I'm going to mention something as it relates to pop culture, because I think all of that is just a distraction from the issues that we really should be discussing as people, and it's just nothing for us and our humanity. So again, if you like to discuss and think about different legal topics and public policy, then this is a channel for you. So don't forget to like and share with anyone else you think will find value. Also, I have another channel. It's titled Access Wellness Abroad. It's my second YouTube channel, and it is dedicated to discussing various policies other countries are using to improve their population's quality of life. So we look at different countries, European countries, Caribbean countries, countries in South America, to see what policies they're implementing to make their people happier and more productive members of society. And it's something America should pay attention to, because there's no shortage of problems and unhappiness in the United States, despite the wealth in this country. So if you're curious about what other countries are doing, check me out on Access Wellness Abroad. The link to that channel will also be in the description box. Also, here's my third housekeeping topic. Also, I would like to invite you to come on a trip with me to Colombia. If you are one of the many Americans who are underinsured or have no health insurance, and so you have been unable to receive treatment, receive services, medical services, or dental services, I invite you to take the leap of faith and join me on a trip to Colombia for 2 weeks to get comprehensive medical and dental attention. Americans are one of the countries that suffer in terms of healthcare. Now, the healthcare expenditure, American healthcare is very expensive, but access to healthcare, leaves a lot to be desired. So if you're one of the many Americans that need to see a doctor, come with me to Colombia. If you need to see a dentist, if you need an implant, an average implant in the United States, just for the implant, not for leading up to the implant and the post-care, $4,000. It's not even close to that in Colombia. So if you're one of the many Americans suffering who can't chew your food, who can't smile because your teeth impact how you smile and how you present in the world and your attractiveness, come to Colombia and receive dental care at a fraction of what it would cost you in the United States. I know it's ambitious and you're scared and you're wondering whether or not they have prehistoric tools in Colombia. Au contraire, Colombia leads the world, coming in at number 22 in terms of healthcare. 40 of the hospitals in South America happen to be located in Colombia. Colombia is regarded around the world as having robust, comprehensive, advanced health care compared to other countries. It outranks the United States and Canada. So you'll do better in Colombia than you will as an American in America in terms of access to health care and advancement of treatment, testing, all sorts of things. Again, if you're struggling with your health, you need to see a physician, come with me to Colombia. The link for the information is in the description box. Also, I'm going to do a follow-up video, a frequently asked questions video, to address some of the concerns and the questions, the repeat questions I keep receiving, so all the information can be in one place and you can refer to that. But if you have nuanced questions, individual questions, there's also an email to email me and my team, and we can address some of those questions. And even if you want to get on a Zoom call and you're reticent but you're ready and you're concerned about Colombia, we could go through all of that. I'll walk you through. If you come to Colombia, it's an organized group trip with other Americans, with a translator, so you'll always be accompanied by somebody and you won't be alone. So I really think it's a wonderful opportunity for you. And even if you just want to come to Colombia and you don't really have any healthcare issues, it's also a sightseeing trip too, because we're not just seeing doctors and dentists, we're also excursions, there'll be dance classes, be wonderful opportunities. So it's almost like a vacation, and you get to see a doctor at the same time. So if you're interested in that, the link to that is in the description box. I think that's it for housekeeping. So without further ado, let's discuss why Americans are dying at an alarming rate compared to other citizens of developed and industrialized nations. The life expectancy in America has dropped for nearly an unprecedented second year in a row, down to 76 years of age. While countries, not just developed nations, all over the world saw a life expectancy rebound during the second year of the pandemic, the United States did not. In addition, maternal mortality in the United States reached a high in 2021. Also alarmingly, in a paper in the Journal of American Medical Association, found rising mortality rates among American children and adolescents. Now, in this paper titled "The New Crisis of Increasing All-Cause Mortality in U.S. Children and Adolescents," Stephen Wolfe, one of the contributing authors of the paper, wrote that this is the first time in his career that he's ever seen an increase in pediatric mortality. It's always been declining in the United States for as long as he can remember. Now it's increasing at a magnitude that has not occurred for at least half a century. Now this finding is especially alarming because the life expectancy in industrialized country has always lengthened over the past century with advanced medicine, testing, screening, or it's a better food, access to food. Yet increases in U.S. life expectancy stopped in the U.S. after 2010, a trend attributed to rising mortality rates among individuals aged 25 to 64 years old. That's scary because that is the workforce. Although midlife mortality rates increased over the past decade, mortality rates among children and older adults continued to decrease. Now, the COVID-19 pandemic altered this trend and resulted in sharp increases in mortality among older adults, and that's unsurprising. However, pediatric mortality rate also increased, and COVID-19 contributed little to this surge. The increase in all-cause pediatric mortality has an ominous implication. A nation that's losing its most cherished population, its children, faces a crisis like no other. American children are less likely to live to age 5 compared to other children in other high-income countries. So again, the authors of this paper write that even Americans with healthy behaviors and habits, for example, those who are not obese and do not smoke, still appear to have higher disease rates than their peers in other countries. How could this be happening? In a country that prides itself on scientific excellence and innovation and spends an incredible amount of money on healthcare. I mean, the U.S. leads the world in healthcare expenditure. But the population keeps dying at a younger age. And this is not a concern that affects a specific demographic, this downward trend that is. It's across every demographic group. Americans die at younger ages than their counterparts in other wealthy nations. Now, Americans are used to hearing about how their poor diets, their sedentary lifestyle, their poor work-life balance, that they're outworking every other country, and so that makes their health poor. But it's beyond habits at this point and sedentary lifestyle. The problem is more nuanced and complicated than lifestyle. The researchers of this article show that what they call the U.S. health disadvantage, the fact that living in America is chronically worse for your health and makes you more likely to die younger than if you lived in another wealthy country like the UK or Switzerland or Japan. So after looking across different age and racial and economic and geographic groups, what the paper found was that this problem existed in almost every category. There is data that actually show that even the top proportion of the US population, the 1%, the wealthiest, the ones who have better access to doctors, early intervention, early testing, more education, who have resources for therapy, massages, whatever, house managers, that even though they're the top proportion, despite their access, they are still disadvantaged. Why? Well, the panel looked at American life and death in terms of public health and medical care systems. So individual behaviors like tobacco use, social factors like poverty and inequity, the physical environment, public policies, and values. In every one of those aspects, there's problems that distinguish the United States from other countries. And a person's wealth does not insulate them from the exposure to those problems. Yes, Americans eat more calories. They don't have access to universal health care. There's also higher child poverty. There's segregation. There's social isolation, and more and more and more and more. And the cities are designed to make access to quality food difficult. Everyone has a pet thing that they're worried about, even the oral health, suicide, plant-based diet, vegan diet, all meat diet. Everyone has something that's legitimately something to pay attention to. But that's because there's no shortage of problems. But solving or paying attention to what the problem is, we have to look at what's going to have the biggest impact and tangentially improve those other areas. The problem is complex and it's varied, but a big part of the difference between the life and death in the US compared to peer countries and people dying is also people being killed before the age 50. The Shorter Lives report specifically points to factors like teen pregnancy, drug overdose, fatal car accidents, injuries, and violence. America is a very violent country. But America does do a few things right. According to the report, the United States' higher survival rate after age 75 than do peer countries. And that also means there's a higher rate of cancer screening, better control over blood pressure and cholesterol levels, lower stroke mortality, lower rates of smoking. Americans smoke less compared to other countries, wealthy countries, European countries, higher average income. But those achievements aren't enough to offset the problems that befall many Americans at younger age. Having a sicker population costs the country as much as $100 billion every year in extra health care costs. Behind the statistics detailed in this report are the faces of young people, infants, children, adolescents who are unwell and dying because of conditions in this country that are not favorable as those in other countries. And health has a big part of it, but also the violence. Now, the article is full of recommendations for the US government to implement, especially the NIH, which has a budget of more than $40 billion annually to conduct research to improve Americans' health. What the article recommends is simple: for the US to look at other nations to see what's working. Now, the NIH should undertake a thorough examination of the policies and approaches that other countries that have shown a better health outcome. That's just useful. But the opponents say, well, that's a homogeneous society. We're not like them. Our population is different. But that's not true. Evolutionarily speaking, we're all Homo sapiens. And evolution happens in millions of years. Therefore, humans still need the same things despite cultural, social, geographic differences. Basic evolutionary needs ensures that the population has a basic necessity, does wonders for a healthy society. We haven't removed ourselves from the basic needs. So the author again presented these findings to the NIH, and guess what the NIH said? They weren't interested. There was some media coverage at the time that the report rolled out, but the NIH was not involved in trying to promote awareness about this epidemic. The federal agency charged with the health of Americans was not interested in why Americans were dying earlier. And so the lack of response to this epidemic shows that there's a misconception to assume that Americans' great scientific minds and medical discoveries translates to progress for the health of the population. We are actually very innovative in making these breakthroughs, these scientific breakthroughs. America really is innovative in that. But very, very, very poor in providing them to benefit the general population. Now, the Department of Health and Human Services, the Secretary Xavier Becerra answered some of the questions when this presented about these findings at a press conference earlier in 2023 to address they questioned him about this life expectancy, why it was lagging. And he mentioned COVID-19 and vaccine hesitancy along with mental health issues and gun violence. And then he went on to say, there's so many things that we're doing, Becerra said. We can't touch everything. We can't touch state laws that allow an individual to buy an assault weapon and then kill so many people. We can only come in afterwards. Is that true though? The CDC director, Rochelle Walensky, responded listing some of the agency's work on mental health and vaccines, and acting NIH director, Larry Tabank, pointed to research on health disparities. So here we have the NIH, the CDC, the HHS, Health and Human Services, all presented with this problem and ostensibly deflecting and saying we can't really do anything about it, or we're not interested in doing anything about it. And when the data is presented from other countries, here, these are the solutions, these are the step-by-step solutions, they say, well, the other countries aren't the flavor of the month. Yet, if you add up the excess deaths that have occurred in the United States because of the unfolding problem, it dwarfs the amount of deaths due to COVID-19, as horrible as COVID-19 was. We've lost so many more Americans in the aggregate because of longer systemic issues. And if the systemic issue remain unaddressed, it will continue to claim the lives going forward. The important point about U.S. healthcare disadvantage is not that the United States is in some competition with everyone else. It's that Americans are dying and suffering at rates that are demonstrably unnecessary. Rather than feeling overwhelmed at the immensity of the problem, the focus should instead be on the fact that every other rich country has been able to figure out how to help people live longer, healthy, happier lives. That means that Americans could do it too. The change might be as hard as some policymakers and health officials seem to think. It's not that hard. You look at healthier countries, they're free too. Switzerland, France, Italy, Germany, Spain. America likes to market itself as if it's the only free country. Other countries are free too. They're not banning delicious food. They're not chaining people to treadmills, making them exercise. They don't even prohibit smoking. Most of these wealthy nations, there's a lot of smoking going on. And Americans love to travel to Europe, Australia, to the Caribbean. And why is that? To enjoy the food, the healthy food with rich tastes, and they enjoy the lifestyles. So maybe we can bring some of that back to the United States. I don't think people are going to be up in arms saying, oh, you're taking away our individual freedoms because we're banning GMOs. Getting policy ideas from other countries is just obvious. Now, in historical research, there have been dozens and dozens of countries in the world that have outperformed the United States for the last, say, 50 years. America leads the world in very few things. The total number of people incarcerated, with more than 2 million prisoners nationwide, and military spending at $877 billion. And of course, healthcare expenditure. Those things are not a flex, nor do they positively impact Americans. As a matter of fact, all that expenditure, and America is still more dangerous and laden with criminality than it has ever been. Obviously, we need a more nuanced solution to crime and violence in this country, because prisons are full and people are still participating in crime, and building prisons is not working. So it's valuable to look at other countries to see what they're doing and just Americanize it somehow. Now, let me know. I'm going to leave it at that because there's a lot in this video. So let me know your thoughts. Do you think American policymakers should look to other nations in order to implement policies to improve the health outcomes in the United States? It's not a one-size-fits-all, but it's a step in the right direction. If you have other suggestions, let me know in the comment section. And I know you might be thinking like, you're an attorney, why are you discussing this? Because, as a matter of fact, 60% of my practice is dedicated to estate planning. So I have no dog in this fight. As a matter of fact, it's bad for business for me to tell Americans that they're dying at an alarming rate, because I benefit from Americans dying because I prepare their assets. That's my business model. I prepare their assets to transfer to the younger generation. But that's how dire the situation, that I want to bring it to your attention because I have firsthand experience to this. You know how many times I have to go to the hospital to see a dying client? This is impacting all of us. And oh yeah, we're gonna die no matter what. We know that's guaranteed, but our quality of life up until we die, why can't we have a better quality of life? And our government is responsible for ensuring that. So let me know your thoughts in the comment section. Again, I will also link the article that was discussed to discuss the downward trend of life expectancy for Americans. That will be linked in the description box. Information about my other YouTube channel will also be linked in the description box. And the Access Wellness Abroad trip to Colombia, the information regarding that will also be in the description box. And I'll leave you with that. Don't forget to like and subscribe and share with anyone else you think will find value. And I will see you next time. Bye-bye.